Speaker and honorable members, in my earlier response, I did indicate that we do have immediate and short-term measures, we have medium-term measures, and we have long-term measures. The medium and long-term measures, Honorable Speaker and members, are to ensure that this does not occur. And this includes development of policies. The internship policy, Honorable Speaker, I have already said that our plan is to finalize by end of April. We have already done internal stakeholder validation. Next week, we shall be going to external stakeholder validation. And by the end of April, this policy shall be taken to Cabinet for consideration. And after that, it shall be brought to this House. Honorable Speaker and members, those are some of the strategies that we have put in place to ensure that this does not recur. Strategies to ensure coordination between the Ministry of Education and Ministry of Health. During this crisis period, Honorable Speaker and members, we have met together with my colleague, the Cabinet Secretary for Education, and we have put together a joint committee that includes the Commissioner of University Education, the Kenya Medical Practitioner and Dentist Council, COOPS, that is the one that admits students, the universities. And we have given them a timeline of 1 month to be able to look through what is it that is required in terms of production, in terms of the available facilities for training, and what we need to do to ensure that then we are training enough numbers that we are able to cater for. Honorable Speaker and honorable members, many years ago, it was only one university that was training medical officers, medical doctors in this country. As we speak now, we have 8 universities, 5 of them public and 3 private. All these, Honorable Speaker and honorable members, we have put them in the joint committee so that then we can find a solution that all the interns who come out of these universities, then we are able to absorb them for internship. From Honorable Nyikal, Honorable Speaker and honorable members, Honorable Nyikal is a member of the Health Committee, and on many occasions, I do refer to him on these matters. The issues that he has raised regarding the cadres that need internship. As a ministry, we have a total of 32 cadres, different cadres, all of them seeking recognition, all of them seeking to be paid for internship. But however, from this, only the medical officers, the pharmacists, the dentists, the degree nursing, degree clinical officer, and diploma clinical officers are the ones so far who enjoy stipends. So as the ministry works on the policy that we are working on, we will largely benefit from the wisdom of Honorable Nyikal on what we need to do in terms of recognizing the other cadres and also enhancing the cadres that are already getting the stipend. Medical insurance by national government recognizes all workers, all medical officers who work for national government. Honorable Speaker and honorable members, as we stand here, we very well know that those medical doctors who work for the national government, they work either at the ministry headquarters or they work in one of the referral facilities, the 6 referral facilities that we have. And those are the ones that I am confidently saying that the national government, through the Ministry of Health, has provided them with medical insurance. Honorable Speaker and honorable members, I am not in a position to confirm whether counties have indeed given medical insurance to their medical officers. That can only be confirmed by themselves, but from this crisis that has been going, a number of them, 36 of them, have confirmed to have medical insurance, and those who do not have, they have been asked to ensure that they have medical insurance. Regarding the registrars, we are working on a policy, Honorable Speaker and members, a policy to ensure that there's direction from Ministry of Health, because even as we train registrars, we must train those skills that are required for the national, those skills that are required by the country. We do not want to train excess of one skill and leave out another. So that policy is under development. Payment of interns. Honorable Speaker and honorable members, we were directed and guided by SRC, which is the body that is constituted by the Constitution to be able to guide. And from the guideline, they said it cannot be a remuneration, it can only be a stipend. And that is how we have recognized it. Honorable Speaker and honorable members, from the question from Honorable Mishimboko, what is the gross salary of an intern and what is the net thereof and what has been offered? Initially, an intern was earning $206,000. This includes basic salary and other allowances. That comes to a net of $135,000. Honorable Speaker and honorable members, based on the advice from the SRC, it is now a stipend of 70,000 shillings. And Honorable Speaker and members, I would like to clarify that none of the interns who is in session has gotten a reduction. Of the interns in session that will be finishing or concluding their internship in June 2024, there is no reduction. It is the new interns who we are now posting that are going to get in under the terms of the stipend. From Honorable Junet, the issue of whole of nation approach. This was ordered by the Honorable Judge of the Employment and Labor Relations Court. That order is what brought us together. And the judge did guide on the membership of the whole of nation approach. And in respect and in compliance with the court order, that group under the whole of nation approach has been meeting to find solutions to this crisis headed by Head of Public Service. Honorable Speaker and members, Honorable Junet wanted to know how 70 was arrived at. This was a guideline by the SRC. They would be the best then to explain how 70,000 was arrived at as a stipend. But need to say that they did look at the other interns within the nation, and actually they did inform us that the other interns are getting 25,000, and therefore they considered this higher and gave them 70,000. From Honorable Zamzam on Linda Mama, Honorable Speaker and honorable members, I would like to request, because there is a specific question on Linda Mama, I would like to request that I respond to it, because it's a substantive question that I'll be responding to later. Honorable Speaker, from Honorable Mwenje, he asked about expectant mothers and where do they go at this time of a crisis. Honorable Speaker and honorable members, I would like to appreciate Honorable Mwenje that despite him being a man, he is caring for the women. And for me as a woman, this is personal to me. As we speak now, Honorable Speaker and honorable members, we have levels of service in the Ministry of Health. We have level 2, which are dispensaries. Closest to the people within the villages, services are ongoing. We have level 3, which are health centers, Honorable Speaker and honorable members. Services are ongoing in those places. Where we are affected most by this crisis is level 4, level 5, and level 6, which are referral hospitals. But we have put measures in place to ensure that emergency services are being attended to. Last week when I did a tour of Kenyatta National Hospital, the maternity was full. Actually, all the expectant women around Nairobi are now in Kenyatta National Hospital being attended there. So we really have to see that the ministry has put in some effort. And I also want to thank Honorable Speaker and honorable members that despite this crisis, we have very patriotic doctors who are working. We have been able to fill some of the gaps with those doctors who have been able to continue providing services, and I want to thank them tremendously for continuing to provide services to Kenyans. What have we done on rationalization? Honorable Speaker and honorable members, after the SRC guidelines.
Junet, what is your point of order?
Mr. Speaker, I don't know whether you listened keenly to the Honorable Minister. The Honorable Minister, Mr. Speaker, has put up a very rosy picture that hospitals are working, Kenyatta Hospital is full, doctors are working, level 4, level 2, level 2. Mr. Speaker, that is not the situation on the ground. Madam Minister, people, there are no hospitals that are working. There are no wards that are full, Madam Minister. We are the people who are from the ground. Just say you are working on how to rectify the matter, but as of now, even the maternity that is full in Kenyatta Hospital, mothers are delivering on their own, or maybe with the help of few nurses.
Go on, Minister.
Thank you very much, Honorable Speaker and honorable members. Level 2 dispensaries are manned by nurses. We have over 9,000 dispensaries in the country, and they are functional. Level 3 facilities are manned by nurses and clinical officers, and most of them are functional. I did acknowledge that indeed we have a problem at level 4, level 5, and level 6. But I say emergency services are being offered. And I just gave an experience of my walkthrough of Kenyatta National Hospital last week. Honorable Speaker and honorable members, on what the ministry has done in rationalizing, after we received the guidelines from the SRC, we, the ministry, met with the National Treasury on 2 occasions. And that is how we got to get 2.3 billion to be able to post the current interns. We have also been getting the numbers that are in the pipeline in the training institutions, so that then we plan ahead through the budgeting process to ensure that then they are taken care of. The other question, Honorable Speaker and members, is what is the ministry doing to ensure that this does not recur? And I would like to reiterate, Mr. Honorable Speaker, that through the medium-term, long-term position that I had raised earlier, we believe that the ministry will be able to resolve this, and this does not recur. However, Honorable Speaker and honorable members, I would like to thank members of this House that the ministry brought to this House 4 acts, and they were able to be processed. One of the outcomes of those 4 acts is the Social Health Insurance Act. The Social Health Insurance Act, Honorable Speaker and honorable members, as we sit here today, less than 20% of Kenyans have some form of medical insurance. So what we intend to achieve with the Social Health Insurance Act is to drive those numbers up and ensure as many as possible. Our target is to get at least 80% of Kenyans to be on insurance. And once resources are raised through the Social Health Insurance Act, we want to believe that we'll be able to take care of commodities, take care of equipments, and take care of the most important pillar of universal health coverage, which is the human resource for health. Honorable Speaker, the question from Honorable Kajwang about the CBA. Honorable Speaker and honorable members, we cannot live in denial. We have 2 levels of government, the national government and the county governments. A collective bargaining agreement is a document signed between an employer and an employee. The ones that I spoke about, the CBA progress that has been made by the national government, is for those employees who are for national government. And therefore, I can authoritatively say that as the national government, we have managed to implement some of the things asked for in the CBA. Therefore, the relationship between the employer, who is county government, and the doctors then should be managed as such between the county governments and the employees. The issue of return to work formula. Honorable Speaker and honorable members, this matter went to the court, and the honorable judge ordered that the doctors should suspend their strike and give negotiation a chance. And they did order that then discussions should continue under the whole of nation approach to this matter. And I want to believe once discussions are finalized, the doctors have suspended the strike, then a return to work formula will be arrived at. Thank you, Honorable Speaker and members.
Kibagendi. Honorable Nyikao, you're out of order. I've not given you an opportunity.
Thank you.
I will come to you.
Thank you, Honorable
I
Speaker.
hardly give members to have a second bite, especially when you're a joyrider. Yes, Kibagendi?
Thank you, Honorable Speaker. And